folks. Welcome to another edition of the Healthy Way right here on Love 101, the family station. So, as you know, October is Breast Cancer Awareness Month. And so today we're going to be talking a little bit about breast cancer, right? Now, other than skin cancer, breast cancer is the most common cancer among women. Mammograms are the best way to find breast cancer early. And when it is easier to treat and before it is big enough to feel or cause symptoms. So, with us this morning is Dr. Alex Tracy. Hey, Dr. Tracy, how are you?
Oh, hi. Good morning.
Good to have you. What do you want to add to that, Dr. Tracy?
Well, just to say that breast cancer is actually one of the most common cancers related to females.
Mhm.
It's a significant cancer because it's one of the leading cause of cancer-related deaths in females.
Right.
One of the things that I can congratulate the medical fraternity about is that there has been a decrease over the years with the increase in education of patients,
Mhm.
as well as the increased level of early screening, that the early detection through screening.
Mhm.
And also the public or members of the public has had an increased interest in terms of detecting breast cancer early.
Mhm.
So that has led to a decrease in not only the incident, but
Mhm.
the cancer-related death related to breast cancer.
Right. When we talk about the risk, we made mention of being a woman. So that's a
Right.
risk.
So yes, the risk factors. Obviously, one of them would be for you to be a woman. Be aware that there are males
Right.
that have cases of breast cancer,
Mhm.
but it's predominantly in females.
Right.
If you have a family history of breast cancer, you may be at risk.
Right.
And if you have actually had a previous history of breast cancer, you are also at risk of developing breast cancer again,
Mhm.
right? Other
I gather
things
your
that may
age. Yes, being older could be one.
right.
Yeah.
So your age, exposure to radiation is another risk factor,
Mm-hmm.
and last but not least is like obesity. So like obesity is known to actually be associated with breast cancer.
Mhm. And with that, let's talk a little about lowering one risk. So you said obesity, so obviously they need to keep, a, a decent weight and exercise regularly. What else are we talking about when we're saying lower the risk?
Well, you would want to know if you're at risk, so discuss it with your doctor, finding out your risk level. So
Mhm.
you would go through a series of questions, asking if you've had a family history of breast cancer. If you do your actual personal examination, he may actually go ahead and show you how to do a breast examination. Um, he himself may actually go ahead and do a breast examination on you, right? You want to actually be able to do a proper breast examination, and this can be done daily, can be done twice a week,
Mhm.
but it's important for you to examine the breast properly.
Right.
Be aware that part of the breast actually goes up into your armpit, right? That's the
Mhm.
axillary breast.
Mhm.
So you not only examine just the anterior aspect of the breast, but also the lateral aspect, which goes up into the axilla, right?
Mhm.
If you do have a family history of breast cancer, then you would want to start screening earlier than usual,
Right.
right? So that you can actually detect whether or not you have breast cancer from early,
Mhm.
right? So those are some of the things that you may want to take in consideration when assessing someone's risk
Right.
for breast cancer.
What about breastfeed your children, if possible?
But yes, that is actually associated with a lower risk of breast cancer.
Mhm.
So what you would realize is that one of the risk factors for breast cancer is persons that have never been pregnant, right?
Right.
Not to say that everybody should aim to get pregnant now, but
Right.
that is one of the risk factors. Females that have never been
Never been
pregnant.
pregnant. All right. So let's go through some symptoms you mentioned one a while ago. So a new lump in the breast or on the arm. That's a symptom.
Right. And whether or not it's a painful or a painless lump, you should go ahead and check it out. Any form of discomfort that you're having in the breast, whether or not you're feeling a lump or not,
Right.
you should be assessed by a medical professional to determine whether or not it is breast cancer, regardless of your age, right? Because we have had young persons who have had breast cancer. The other thing is you may have what is called dimpling of the breast. You may also have inversion of the nipple. So instead of the nipple pointing outwards, it's pointing inwards.
Mm-hmm.
And that may have just suddenly developed or developed over time. Regardless, you should check it out.
Right.
You may also have erythema or redness over the area. Some cases, you may have crusting of the nipple or crusting on the breast, almost like a sore, a chronic sore. These are some of the signs that may pinpoint you to say, hey, something is definitely wrong. I need to go ahead and check it out to see if this could be a case of breast cancer.
Yeah. What about any change in the size or the shape of the breast?
Right, right. So once you have a lump in the breast, especially if it's big, it's going to cause the size of the breast to actually be off. So you would actually get one breast looking bigger than normal. And usually on an examination by a doctor,
Right.
it is it's more expressed when the person kind of squeeze the size of the waist, right? So you may actually see we do certain little maneuvers to see if there is asymmetry in the breast, right?
Right.
Now, one of the things that we have to understand is that breast cancer, the prognosis related to breast cancer is dependent on early detection.
Right. Right.
So once you actually have any form of abnormality on your self-breast examination, then you need to reach out to a doctor. You need to go ahead and get assessed as quickly as possible so that we can determine if we need to remove that lump, right?
Right.
One of the things that we actually left out is that related to breast cancer, you may also have lymphadenopathy, which is swollen lymph nodes, right?
Oh.
So you may have swollen axillary nodes, which would be under the armpit. And this is usually in a case where there's signs of spread for it to move from the lump to the lymph node. So that's not another sign.
That's another sign. It's quite interesting. And just walk us through if one is listening and they want to do a self-examination. How is it done?
Right. So we usually have circular motions along the breast, start at the nipple, going outward, right? And you usually use the four fingers, right?
Right.
About like three of the fingers, and you kind of smoothly massage along the curvature of the breast until you reach the outer portion of the breast, right? Now remember that you're going to be examining the axillary area as well, because a portion of the breast may go into the axilla. And the doctor may go on to even examine for lymph nodes if he actually finds the actual lump in the breast. Now, definitively, we would want to screen you using some form of radiological investigation. So a breast ultrasound is warranted for young females as they may have fibrous breast. For the older females, we refer to a mammogram, right? The mammogram is more for fatty breast. However, you may actually have cases where you have to do both a mammogram and an ultrasound, especially if you're suspecting that the lump could be a And if there's a lump and it's suspicious, we may want to sample it. So we
Right.
may do what is called a biopsy, where we take some of the tissue and we send it for testing. In
Mm.
some cases, we may go ahead and then remove the entire lump, something called an excisional biopsy, and we send the lump to be tested
Right.
by the lab to determine if it is cancer.
Cancer. Mm. Well,
Right?
we're out of time. We have
All
to pick
right.
this conversation up again. It's
Right.
it's 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 a lot.
It's a lot
Right.
because breast cancer is a very big topic,
Right.
right? But just to state again, the importance of early detection.
Mhm.
So early detection allows us um,
To save your life. Yeah, it's quite important. Or I think yes, Dr. Tracy's out. I'm so sorry, but I'm out of time. Let's come back again next time. We have to pick this conversation up. And of course, you can reach him at the Online Medics, Shop 128 Greater Portmore Shopping Center. Give him a call, 876 3366 886. This has been the Health Way for today, breast cancer. Yeah, join us again next time as we pick the conversation up once more. This is a family station. Stay with us.